Prostate imaging refers to the various techniques used to create medical images of the prostate. These images are used to assist doctors in forming a diagnosis for many possible pathologies of the prostate. In this video, we will discuss the current and emerging technologies used to produce medical images of the prostate, as well as the efficacy and risks associated with each imaging modality. There are several imaging modalities that can be used to detect and locate prostate abnormalities. To weigh up the pros and cons of each modality and its usefulness, several factors are taken into consideration. Quality and reproducible images, which is the ability to detect volume, asymmetry, and growths within the prostate, and ability to view and compare changes over time. Restrictions of each modality, such as the inability to use MRI on patients with pacemakers or metal implants. Risks associated with each modality. For example, increased exposure to ionizing radiation over time. Ultrasound imaging is used to evaluate abnormalities, cancer, and other prostate-related conditions, as well as to assist in guided biopsy of the prostate. A small ultrasound transducer is covered in gel. The probe is then inserted into the rectum and moved around to produce live images of the prostate from various angles. This is done to observe symmetry and volume of the prostate to indicate any abnormality. Ultrasound is also used to guide a needle for biopsy, which is the standard test to confirm the presence of a cancer. Positron emission technology, or PET imaging, is a modality aimed at showing organ or tissue chemical function and does not show structure. PET imaging is mainly used for highlighting metabolic, molecular, or cellular activity of prostate cells and is used in conjunction with anatomical imaging in the form of MRI or CT. Different radio tracers are used for mapping different biochemical and cellular properties. PET imaging is currently used more widely for cancer staging and assessing biochemical failure in the context of metastatic involvement or after radiotherapy treatment. Due to its limitations, PET scans are not commonly used for initial prostate cancer diagnosis. New advances in PET imaging have been made using a new molecular probe targeting the prostate-specific membrane antigen, PSMA. PSMA-based imaging has been shown to offer higher tumor detection rate compared to choline PET-CT and radiological conventional imaging, especially at very low prostate-specific antigen levels during biochemical relapse, which is a scenario that typically does not return positive cancer diagnosis. CT scans are useful in detecting the location and extent of cancer that has recurred after treatment and its spread to other parts of the body. CT scans are not typically used for diagnosis. Rather, it is used when a diagnosis is made, as it can provide information on the grade and stage of the cancer. The grading and staging is determined using the Gleason score and the tumor node metastasis system. CT scans are used to detect the metastasis of the cancer, particularly around the lymph nodes. It can also map the growth of prostate cancer that has come back post-treatment on organs or structures near the pelvis. A contrast dye can be used as part of the imaging process to make certain parts of the body clearer in images. A magnetic resonance imaging scanner uses strong magnetic fields to create an image of the prostate and surrounding tissues. MRI is a useful tool in early diagnosis and evaluation of prostate cancer. Evidence shows that multiparametric MRI is the most accurate way to measure features of the prostate gland. It provides detailed images of the anatomy, vascular structure, and tissue density of the gland. Multiparametric MRI can help look for cancer in the prostate that are clinically significant and have life-threatening potential. MRI provides information regarding tumor location, volume, grade, and stage. MRI-based prostate cancer risk assessment has been shown to better distinguish between clinically significant and insignificant tumors than prostate-specific antigen testing alone. Although each imaging modality can image the prostate and possibly detect and guide diagnosis, there are risks and limitations inherent to each one. A common risk among most imaging modalities such as CT and PET are from the production of ionizing radiation and the adverse effects that it has on the body. Unlike many other imaging modalities used to image the prostate, ultrasound does not produce ionizing radiation and as such poses none of the usual risks associated with exposure to radiation. The frequencies of sound waves used to produce ultrasound images of the prostate have been shown to be safe in the clinical setting due to the nature of sound waves and the limitation of frequencies used in obtaining these images. If cancerous lesions are not large enough or close to the capsule, they can easily be missed in an ultrasound scan. As the gland grows larger, it becomes more difficult to view and access access the different orientations of the gland, making sampling for biopsy difficult. This could lead to a misdiagnosis of the severity of prostate cancer. PET scans can cause allergic reactions from traces. They have poor spatial resolution, and scans can sometimes show areas of high activity which may be mistaken for cancers. For example, inflammatory conditions such as prostatitis absorb a lot of the tracer, which may lead to a false diagnosis. As PET scans mainly map the PSA levels in the body, this could also lead to misdiagnosis, as high PSA levels could be indicative of benign prostate hyperplasia. Thus, to avoid misdiagnosis, a biopsy or other imaging procedure is required to make a full diagnosis. As CT scans are predominantly used to provide information about the grade and stage of cancer, there are limitations to the use of CT scans in newly diagnosed prostate cancers. Although CT scans are generally safe for most people, there are possible risks associated with radiation dosage and uptake of contrast medium. The use of contrast agents are used to obtain more detailed images. However, the risks associated with contrast agents include allergic reactions and the medium leaking out the vein. Generally, MRI is known to be safe to use as it is non-invasive and no ionizing radiation is used. However, a presence of any metallic implant is restricted due to the large static magnetic field. These include cardiac pacemakers and life support equipment with magnetic steel. Another limitation of MRI is that it cannot always distinguish between cancer tissue and inflammation or presence of blood products within the prostate, which can sometimes occur during a prostate biopsy. To avoid confusion, a prostate MRI may be performed 6 to 8 weeks after the biopsy. Technological development in the field of prostate imaging is aimed towards combining imaging modalities to make up for shortcomings that certain modalities may have. Radiotherapy is typically a process that makes use of CT images. The main issues with using CT lie in poor tissue contrast and difficulty in capturing moving organs. By providing a clear functional and anatomical image of the prostate, radiotherapy planning becomes much easier and thus more effective therapy can be delivered. Ultrasound-guided biopsy is the most common form of image-guided biopsy, and biopsies are the main way of distinguishing prostate pathologies. However, transrectal biopsies have a 44% rate of true positive diagnosis and a 30% rate of false negative diagnosis. An alternative to this is real-time MRI-guided biopsy. This uses the clear, detailed, functional and anatomical images from MRI in real time and allows for precise biopsies. Studies show that this method can reveal whether a person has prostate cancer in 59% of cases where the patient has already been given a false negative diagnosis. C11-choline PET-MR is a robust imaging modality for restaging biochemical recurrent prostate cancer, and interpretations between different readers are consistent. It provides higher diagnostic value for detecting local recurrence compared to PET-CT, with the advantage of substantial dose reduction. The only drawback is a slightly longer imaging time. PET-CT is a valuable tool in detecting development of bone metastases in its early stages. This is key in managing the malignancy of prostate cancer. The combination of CT with PET produces an image that requires less ionizing radiation compared to a conventional CT scan, whilst detecting more bone metastases. The image duration is much shorter compared to PET MRI. With the development of many imaging modalities, treatment and diagnosis of the prostate, a gland that is in an awkward position in the body, has become possible, and death rates of prostate-related pathologies have been reduced. An important future direction would be to look at making fusion-based imaging and treatment more readily available and economically viable to the public.